Hello, this is Kendria Martin, and today my presentation will be on validation and reliability of two specialty care satisfaction scales. Okay, starting off, my presentation is on patient satisfaction surveys and how they help increase the level of care that you receive at a physician's office. So basically, the article consists of two scales. One scale being the physician scale for physician care, such as the communication with the physician was effective, if the physician was able to answer all the questions, and then also the office scale, which was basically the timeliness of the appointment, the friendliness, the distance of the appointment, and if the billing and coding was correct. So for the office scale, it consists of 5 items, and they were basically the convenience of the office, the practice location, and if the office staff was friendly and courteous to the patient. And then as far as the physician scale, it consists of 9 items. So the 9 items on the scale were basically if the physician had good communication, timeliness, friendliness, care quality, and were able to answer the questions effectively. So next on the introduction is the Consumer Assessment of Health Plan Studies, which the acronym is CAHPS. And basically, CAHPS is a series of patient survey ratings in the healthcare experience in the U.S. So on the study, we looked at a website called Dr. Scores, and Dr. Scores is basically an online patient satisfaction survey site, and patients regularly visit for specialty and primary care physicians across the nation, and Dr. Score is known for collecting anonymous patient ratings, and within the past few years, there has been a steady increase for satisfaction surveys, so that's why Dr. Score was a good control group to look at for this study. Also, for the participation in this study, we were advertising for patients on the public radio, such as the People's Pharmacy, also through patient advocacy groups and an online search engine such as WebMD. So the instruments and skill development. So it says surveys focus on the most recent outpatient visit and uses a list of U.S. physicians that allow patients to look up their doctors. So basically, like I mentioned before, the participants were chosen from advertising on a public radio show, through patient advocacy groups, and also the online search engine. And also, the surveys ask patients to rate their physicians on several dimensions of healthcare experience, and also to provide specific comments on the aspect of care that they found was most excellent or that needed the most improvement. Like I mentioned before, the physician scales consist of 9 items, and then also the office scale consists of 5 items. The scale was measured on a Likert scale, which is basically a scale that we see mostly in our everyday lives if we're filling out a survey. So it was measured from 0 being not at all satisfied to 10 being extremely satisfied. On my next slide is an example of a Likert scale for a Wikipedia site. It's just an example, but it shows exactly what the scale looked like, and also to refresh your memory so you can see how this scale is being used in your everyday life. It was also used in this survey. Okay, this is an example of a Likert scale, something that we normally use. If you look at the example, it goes from strongly agree to strongly disagree with a neutral being in the middle. This is the type of scale that was used during this survey. So the next slide is about the survey in question. So the survey was conducted in 2006 in December, with a total of 25,000 surveys being collected, but only 12,100 observations were used, and then also approximately 98 of those were rated for adult primary care services. So in the survey, a CFA was used, which is a confirmatory factor analysis, and it was used to verify the patient satisfaction as a measurement to see if the office and physicians correlated. It was hypothesized that they would correlate, seeing that they have some type of correlation as being in the same office, but in fact that was not true, and I'll get into that more later. So next is the tables that were on the survey. Table number 1 gives a demographic of the sample. So 50% of the patients were younger than 35, 48% were between 35 and 64 years of age, and 2% were 65 or older. 64% of the sample were females, and 82% were considered established patients, 76 of those being just going in for a regular yearly physical. Table 2 gives an item descriptive statistic. So the means for all the items on the survey ranged from 7 to 8, and it was negatively skewed. The standardized factor for the physician scale was high, ranging from 0.92 and also to 0.98, which is the test results. The standard factor for the office scale were lower. The standard scale were for 0.91 for the convenience and 0.67 for the staff. Table 3 is a summary of the various properties of the relationship between the variables. So for the physician scale, the mean was 73.3 with a median of 94, while the office scale mean was 75.5 and a median of 88. And both of those scales are skewed to the left, but if you notice, the office has a higher mean and they have a more negative undertone on the study than the physicians do. Table 4 gives the satisfaction scores across the low and the high categories. On table number 4, CAHPS, which I mentioned earlier, which is the Consumer Assessment of Health Plan Studies, was used. The global rating of that was 4.2 on the physician scale, which is below the median that they would have on the Dr. Scores website, which is 9.9. The physician scale was for 5.2, and it was also below that on the Dr. Scores, which is a 9.7. Also, the study showed that there were longer office waiting times, days for waiting on appointments, fewer minutes seen with a specialist, and more room of improvement regarding the staff, the record keeping, the waiting time, physician care, and then also obtaining information over the phone. My last slide is a quick summary of the article. So the article was basically stating that patient satisfaction with care is a big indicator on a component of quality of care. It can help the physician and office staff know exactly where they need improvement, where they have great customer service, and also how to improve the quality of care for the next patient that they encounter. And then also a great sentence that stood out to me in the article says, researchers have suggested that patient satisfaction with care is a unidimensional construct, with the physician-patient relationship serving as an essential source of satisfaction. Also in the survey, it mentioned how the physician scale was much higher due to patients remembering more of their physician's visit when they're actually talking to the doctor, more than the process of them signing in or supplying their insurance information or the location of the doctor's office. The reason for that is because when you talk with the physician, you guys are talking about your health and you're sharing details, so that tends to stick with you more than you waiting in the waiting room. But that aspect is still very important because if you have the patients waiting too long or you have the wrong information for the patient, it will just anger them and, make them want to go to a different facility, and then you'll lose a valuable customer that you could have saved health-wise. Also, on the study that I found very interesting was that the mean age was 35 years old, with women being higher. The reason for this is for 35-year-olds, they are more likely to use the internet, and for women, they are more likely to remember and to reply with feedback more than males do. And then those are some quick things that I thought were really interesting about the article. Thank you for listening to my presentation, and if you have any further questions, you can always ask me on the forum. Thank you.